Comment your name and state below. I'd love to see who's watching and benefiting from these videos. Did you know that thousands of seniors across the country are waking up to letters that say something like, "Your doctor is no longer in network"? For many people, this isn't just paperwork. This is a shock. This is stress. This is fear. Because for a lot of seniors, their doctor isn't just a provider, it's someone they've trusted for years. And if you're on Medicare Advantage, this is a conversation you need to hear carefully in 2026. Over the past year, more doctors and medical groups have quietly stopped accepting certain Medicare Advantage plans. Not because they don't care about seniors. Not because they want to abandon patients. But because the system behind the scenes has been changing in ways most people never see until it affects them personally. Today, I want to explain why doctors are dropping Medicare Advantage plans, what's really happening behind the scenes, who this affects the most, and what you should do so you're not caught off guard. This is not about scaring you. This is about helping you understand your options before a decision is made for you. Let me start with a real-life scenario. Imagine you're 72 years old. You've been seeing the same primary care doctor for over a decade. They know your medical history. They know your medications. They know your family. One morning, you call to schedule a routine appointment, and the receptionist tells you, "We no longer accept your Medicare Advantage plan." Most seniors don't even know how to respond to that. They assume Medicare is Medicare. They assume coverage is stable. And they assume that if they liked their plan last year, it will be the same next year. But here's the first thing every senior needs to understand in 2026. Original Medicare and Medicare Advantage are not the same system. With Original Medicare, doctors decide whether they accept Medicare itself. With Medicare Advantage, doctors must sign contracts with private insurance companies. Those contracts can change. They can expire. And sometimes, doctors choose not to renew them. That's where the trouble starts. One of the biggest reasons doctors are leaving Medicare Advantage plans is administrative burden. That's a fancy way of saying paperwork, phone calls, approvals, and delays. Many Medicare Advantage plans require something called prior authorization. That means before a doctor can order a test, a scan, or even certain treatments, they have to ask the insurance company for permission first. For seniors, this often shows up as delays. You're told, "We're waiting for approval." For doctors, it means hours spent on paperwork instead of patients. Over time, many physicians say this has become overwhelming. Now, it's important to be fair here. Not all Medicare Advantage plans are the same. Some plans are easier to work with than others. Some doctors have great experiences. But the overall trend in 2026 is that these authorization requirements are increasing, not decreasing. Another major reason doctors are stepping away is payment delays and reimbursement issues. Doctors' offices are businesses. They have staff to pay, rent, equipment, and malpractice insurance. When payments from insurers are delayed, reduced, or denied, it creates real financial pressure. Some physicians report spending weeks or months chasing payments that were already promised under contract. For smaller practices, especially in rural areas, this can be the breaking point. So when contract renewal time comes around, some doctors make a difficult decision. They decide they can no longer afford to stay in certain Medicare Advantage networks. From the senior's perspective, this feels sudden. But for doctors, it's often the result of years of frustration. Another factor in 2026 is network narrowing. To control costs, many Medicare Advantage plans are shrinking their provider networks. That means fewer doctors and hospitals are included. This doesn't always show up clearly in advertisements. TV commercials talk about zero premiums, dental, vision, and extra benefits. What they don't emphasize is how limited the network might be. A plan can look great on paper and still make it harder to see the doctors you actually want. And here's something many seniors don't realize. Even if your doctor accepts Medicare Advantage today, that can change mid-year or at renewal time. That's why network stability is becoming one of the biggest concerns for seniors heading into 2026. Now let's pause for a moment and be honest. Medicare Advantage is not bad for everyone. For many seniors, these plans work well. They like the lower premiums. They like having an out-of-pocket maximum. They like bundled benefits like dental and vision. Some people have no issues with their doctors or care. The problem is that Medicare Advantage works best when your health needs are simple and your providers stay in network. But health can change. And networks can change faster than your health does. That's where surprises happen. One of the biggest mistakes seniors make is assuming Medicare Advantage is the same everywhere. It's not. Plans are local. Networks are local. What works perfectly in one county may be very different in another. This is especially important in 2026 because many insurers are adjusting plans due to rising costs, government payment changes, and increased scrutiny. You might hear news about insurers being paid less or being monitored more closely. Seniors don't need to understand all the policy details. But you do need to understand that when insurers feel financial pressure, networks and benefits are often the first things adjusted. That adjustment sometimes shows up as doctors leaving. So what should you do if you're already on a Medicare Advantage plan? First, don't panic. Second, verify your doctors every single year. Not just when you enroll. Not just when you see a commercial. Actually call your doctor's office and ask, do you plan to stay in this plan next year? Third, read your annual notice of change. I know it's boring. I know it's long. But buried in that document are changes to networks, referrals, and coverage rules. Fourth, understand your switching rights. If your doctor leaves mid-year, there may be special enrollment options available depending on your situation. And finally, understand that stability matters. For some seniors, paying a little more for original Medicare with a supplement offers peace of mind because doctor choice is broader and more predictable. For others, Medicare Advantage remains a good fit as long as they stay informed and proactive. This is not about telling you which plan is right. This is about helping you avoid being blindsided. Let me share another real-life example. A retired couple in their late 70s had been on the same Medicare Advantage plan for years. They rarely used it beyond routine visits. Everything seemed fine. Then one partner developed a more serious condition that required a specialist. That specialist was not in network. They could either travel hours away, pay out-of-network costs, or change plans during the next enrollment period. That's when they realized that the plan that worked when they were healthy didn't work when health needs changed. That's why these conversations matter before something happens. In 2026, seniors need to think less about flashy benefits and more about access and continuity of care. Dental and vision are nice. But they don't replace a trusted doctor. Now let's talk briefly about something else that causes confusion. Many seniors assume that if a doctor drops one Medicare Advantage plan, they drop all of them. That's not always true. Doctors can choose which plans they contract with. They might accept one insurer but not another. That's why checking your specific plan is critical. It's also why relying on ads or general advice can be risky. Another thing to understand is that doctors don't always announce these changes loudly. Sometimes offices don't even know until contracts are finalized. Seniors often find out when they try to make an appointment. That's why being proactive matters more in 2026 than it did years ago. Now let's talk about the emotional side for a moment. Losing a doctor feels personal. It feels like abandonment. It creates anxiety, especially for seniors managing chronic conditions. That emotional toll is real, and it's often ignored in policy discussions. The goal of this video is not to tell you Medicare Advantage is failing or that original Medicare is perfect. The goal is to give you clarity. Clarity reduces fear. When you understand why doctors are leaving, you stop blaming yourself. When you understand how networks work, you make better decisions. And when you review your coverage every year, you reduce surprises. As we move deeper into 2026, expect more conversations like this. Healthcare is changing. Insurance is changing. But informed seniors are empowered seniors. If you take one thing away from this video, let it be this. Never assume your coverage stays the same just because your card looks the same. Ask questions. Verify networks. Understand your options. And choose stability over hype when possible. If you found this helpful, make sure you're subscribed because we break down Medicare changes like this every week in simple, clear language. And once again, comment your name and state below. I truly enjoy seeing where you're watching from and knowing these videos are helping real people. And just a quick reminder, I am not a licensed insurance agent. This video is for educational purposes only. Always review your options carefully or speak with a qualified professional before making Medicare decisions. Thank you for watching, and I'll see you in the next one.